My name is Parikh-Shah. I'm a naturopathic doctor. I've been practicing for 17 years now. My interest into Down syndrome started about 9 years ago. 9 years ago was when my little guy came along. We weren't quite sure what would happen because we never actually knew what Down syndrome was when we first started when we found out that he was coming. And it was a steep learning curve for us. He is absolutely amazing. He's in grade 2, he's integrated into school, he has tons of friends. I'm sure we all know what this is like, right, with all of our kids. He's taught me a lot of stuff. Both my boys teach me a lot of stuff, but Jay's been pretty amazing. Everybody knows that March 21st was World Down Syndrome Day. One of the things that my family took on was educating Jay's school on what is Down syndrome. So some of the kids were starting to ask questions, why is he not, his speech is a bit delayed, we don't understand him very well. So this was actually my daughter's project. So she took it on, and bear with me, technical difficulties.
Make a friend. Make a friend.
Oh yeah, just pull it out.
Make a friend. To me, I think making friends is including everyone, being nice to everyone, and not leaving anybody out. Make a friend. A good friend is someone who treats everyone equally and only judges them by the inside. You can have all my friends do that, and that's what I really like about them.
So this video is about, 13 minutes long. I'm not going to play the whole thing. If you are interested in viewing the whole video, it's on YouTube. And Google, search my name, search Make a Friend. No, actually, World Down Syndrome Day, Make a Friend, and it's up there. So, what is naturopathic medicine? Do we know, how many of us are familiar with naturopathic medicine? Some of us. Can you tell me what for those of us who are familiar with naturopathic medicine, have we seen a naturopathic doctor? Yeah. So what kind of things has your naturopath done with you?
For my own health, I suffer from IBS, so just helping with that.
Okay.
And dietary changes, homeopathic medicine, things like that. And then when I had my son Will, we had a lot of chronic ear infections and different things, and we were just looking at ways to try to boost his immunity and just support him in that.
Okay. So that's typically what I tend to see also with the kids that I see that have Down syndrome. A lot of immune stuff. I've had a few kids who've had issues with heart, so heart, the valve malformation. And with some of these kids, we've been able to at least decrease the size of the abnormality, and with some of them, we've also been able to close the valve too, or close the deformity. So there is quite a bit that we can do with naturopathic medicine, especially with kids with Down syndrome. So a few points. Naturopathic medicine blends scientific knowledge along with traditional and natural forms of medicine. Naturopathic philosophy is to work with the body, not the individual, not say the Down syndrome, but we're working with the individual. Because all of our kids have different issues, right? Some of our kids, for instance, with Jay, when he was very little, he had issues with constipation. So what can we do with naturopathic medicine to help him with that? With the gross motor skills, there were a lot of things that I was able to do with him to help him with his gross motor skills. We were able to do with him, it's not just me. So we're working with the body and we're stimulating that power, that healing power of the body itself. Naturopathic medicine can be used to treat both acute and chronic conditions. So like you said, acute meaning the ear infections, so the upper respiratory tract infections. Chronic could be the heart issues that some of my little kids have come in with. And then more chronic would be more digestive stuff, so the IBS, for instance, right? That's a chronic health issue. Treatments are based on the individual. So we would do things like nutrition, we would do botanical medicine, We will work with acupuncture, but if my clients have a problem with acupuncture with needles, I'm not going to use that. Homeopathic medicine we'll do, and then lifestyle counseling too. And as a naturopathic doctor, we also tend to look at what is going on in the person. So not just that they have Down syndrome, but what else do they have? Is there a lifestyle thing? What is their diet like? And also take a look at the family history too. Okay, so some of the therapies that we have, diet and nutrition is the first thing. And I'm going to focus mostly on that with this presentation. I have the agenda coming up, so we'll talk a little bit more about where diet and nutrition comes in. Lifestyle changes is part of what we also tend to do. Herbal medicine, definitely when we have the immune stuff, digestive issues, that's when herbal medicine will come in. Hydrotherapy is water therapy. So for somebody who has issues with chronic immune function, then water therapy would be good. So water therapy would mean something like contrast showers. So I wouldn't do that with kids, but with an adult who is, say, sick or just coming down with a cold. The easiest thing to do is when you feel like you're coming down with a cold, go in the shower. When you're finished with your shower, turn the water to as hot as you can stand it for as long as you can stand it, and then turn it back to cold. And do that a few times. It does not sound good. Especially in the winter, it does not sound good. But it's a great way to stimulate your immune system. You stimulate your blood flow, the red blood cells start flowing, the white blood cells start flowing, and that virus which has hit you will be gone. Pretty amazing. Yep.
Sorry, can I just ask, the wet sock treatment?
Yep, we call it warming sock now.
Okay. Would there be one or the other that would be better?
No, either or.
Okay.
You've done the warming sock?
Yeah.
Okay. And
Well, I'm actually getting sick this weekend, I think, and I don't have any socks with me. I can try out the shower.
Try out the shower.
Yeah.
I know when I was first in naturopathic school, I thought, oh my God, I hate the cold, especially in the winter time. And I used to be somebody who would get sick so frequently. And the first few years, especially with stress, I would get sick quite frequently. And in naturopathic school, I took it upon myself to start doing the contrast showers. And my immune system was pretty good with that. Because, when you get sick, you miss exams, and overall, it's not good. So try that.
How long do you do that for?
As long as you can stand it. So you just keep going back and forth, and you get your whole body into it. So head to toe.
And what is the thing with the sock?
Oh, the warming sock? You take cotton socks, put them in cold water, put them on, and you take a pair of wool socks, put them on, and then you go to bed. And the theory behind this is that you want to stimulate a fever. You want your immune system to be activated. So it'll start a fever, and when you have a fever, that's when you will be able to fight off that virus. As adults, we don't get fevers, right? I don't know, is anybody around here get fever when they get a cold? Yeah, unless if it's a really, really bad cold, then you may end up with a fever, but mostly adults won't do that. You can do that with kids, but kids have a better immune system, so you just want to watch how high the fever goes, because there is a limit as to how high you can let that fever go. And again, that warming, cold, it used to be called cold wet socks. Doesn't sound that nice, so we call it warming socks now. And what will happen is overnight, when you wake up in the morning, your body will have generated enough heat to actually dry those socks. That's what we want. And you've probably done that in the past. Yeah. Okay, homeopathy. Homeopathy, I can do an hour just on what is homeopathy, so I'm going to kind of glean over this. Homeopathy is the use of small doses of natural substances, and we give a single remedy to an individual who has a particular group of symptoms. Okay? We can come back to homeopathy if you're really interested. I can give you a little bit more information on that. Traditional Chinese medicine and acupuncture, I love this. I love doing acupuncture. That's besides nutrition, my next thing is acupuncture. I will not do acupuncture on kids. I want them to like me. Because of my kids that go to the medical doctor, they are freaking out, especially the kids with Downs, right? Because they are getting blood work done, they're getting poked, some of them are getting vaccinated every month with respiratory syncytial virus vaccination, and they don't like going to the doctor. But when they come to Dr. Sajal, they're good. They really do like coming because they know that I'm not needles. Soft tissue manipulation is something that we tend to do, and this is body work. So massage and chiropractic manipulation. I would rather send people off to massage therapists. We do have the training, but I would rather send somebody off to a massage therapist and or a chiropractor if that's needed. Questions?
Just one quick question. With the shower thing, I thought you said when you feel yourself becoming ill, if you already are ill,
You can still do that. It should decrease the duration of your cold. Okay, so some of the health concerns that I tend to see with kids with Downs. The first one is the frequent upper respiratory and ear infections. Then I tend to see delayed gross motor development, decreased cognitive ability, digestion, constipation, picky eaters, food sensitivities will fall into this. And then, so this is the agenda of what I want to do, what we'll talk to you guys about. The last one is supplementation to neutralize the effects of the extra chromosome. So that's going to be very science-oriented when we get there. My background is in molecular genetics, so my undergraduate is molecular genetics, and then I kind of went completely 180 and decided to go into naturopathic medicine. So molecular genetics is very, very science, and back when I was in school with naturopathic school, it was completely the flip side. So if I am getting too detailed, or if you're not quite comprehending the science, please stop me, okay? All right, so frequent respiratory tract infections. What have you guys been told as to why your child gets sick? Yep.
Because it's so small, the small passageways and
Yeah.
things get, congested.
Yeah, so the small passageway, especially with the ears, ear infections are pretty common with kids with Downs. And then there's also the low muscle tone too. So the low muscle tone, it's not able to pump the fluid back down into the nasal cavity and back into the mouth and then for them to swallow. So that's one of the reasons. What else have you guys been told?
Weak immune system.
Weak immune system. So, but you know what? Most kids, general population, most kids don't have the perfect immune system. I don't think it's specific to Down syndrome that they have a good immune system. I'd say across the board, most kids do not have a mature, let's say a mature immune system.
When does the immune system actually mature then?
Typically by the age of 7. Yeah. What else have you guys been told? Okay, so we've been told weak immune system, small size, small, and also the low muscle tone.
milk allergy.
Sorry?
And milk allergy.
Milk allergy. Okay, your medical doctor said that? You figured it out, okay. Yeah, there are certain foods that will cause inflammation in the body. So wheat, gluten, and dairy are the big ones. So when we get to digestion, we'll talk about those foods specifically. So small ear passages, small ear canals, low muscle tone, and also the immune system. And the immune system, as we said, does change as the child gets older. So it does improve as the child gets older. When the child, the birth order also makes a difference too, I find. Yep.
What about twins?
Have you noticed a difference with, are they both with Down
One
syndrome?
has Down syndrome, one doesn't.
Okay, and do you notice a difference with immune system with the
Definitely,
children?
my daughter with Down syndrome gets sick way more often.
Okay.
for sure.
I think it's more because of the low muscle tone and also the small air passages with her. I don't think it's an immune system thing. So birth order, if the first child is going to be so much more healthy than the second and subsequent children. And that is mainly because, and this is in the general population, why would that happen? Why would the subsequent children be more likely to get sick? Exposure, yeah, yeah. You know, when my eldest, my daughter, when she was born, she was great. She did not get very sick at all. But then my little guy comes in, my older son comes in, and she is all over him, kissing him, and the girls are really bad with this. They kiss their siblings all over the place. And Tharu, my older son, would get sick more often than Anjali, my daughter, would. So the birth order also makes a difference too. Breastfeeding is also really important. So we've got a little one. So I would encourage, if they're tiny still, I would encourage mom to keep nursing as long as she can. World Health Organization says 1 year now for breastfeeding. Not exclusive, but 6 months exclusively, and then at least up to a year. If you can go longer, that I think in terms of immune system, that would be so much better. In terms of what the child gets from breast milk, they get the antibodies, they get protein. We talk a lot about protein, and they also get the minerals too, and the vitamins from the breast milk. So it's very, very important if we can, if they're little, still continue breastfeed. I'm not saying breastfeed until they're 4 or 5 years old. Just saying breastfeed until as long as you're comfortable and the child is comfortable. Okay, so what have we done in terms of treatment for our kids who have ear infections or colds? I should go back. What have we done? Because we've all had our kids at some point have a cold, right?
Antibiotics.
Antibiotics. Okay. Did you do probiotics after that?
Not in those days.
Not in those days. Okay, but now you do. All right. Okay. Probiotics. Do we know what probiotics are? Okay. All right. So probiotics, for those of you who aren't nodding, is just bacteria that lives in the gut. When you take antibiotics, it kills most of the good bacteria. So we need to take probiotics to regenerate those bacteria. What else have we done?
Salt nasal spray and
yeah, like a neti.
Do this.
Yeah, like a saline solution, neti pot.
Neti pot's too complicated, so we just spray.
Oh, you just spray. Okay, that's a great way of getting stuff out and keeps and allows them to breathe well.
Yeah, and this.
Massaging.
Yeah, from the chiropractor.
Okay, good. All right. What else have we done?
With chronic, we're on our 4th set of tubes.
Sorry.
Permanent tubes.
2 tubes? Okay. All right. And you know, sometimes you do have to go to the tubes, like especially if they're getting this chronic ear infections, because the hearing is also very important for speech too. So we're not going to say you can't do this, because in terms of development, cognition, the speech, the language is also very, very important. Yeah.
We were told to do tonsils and adenoids.
To take them out.
Yeah, we did actually.
Okay. And is that helping with the immune system?
It actually did help a lot.
Okay.
With the ear infections.
With ear infections.
And just the colds. But it's hard to know because how much of it is due to that and how much is due to just growing up.
Exactly.
Right? So
yeah.
Not quite clear.
And does it, when she gets sick, does it go into the chest or
no,
is it just
it never
up?
did. It was always just, top nasal sinus thing.
Okay.
Yeah.
After the tonsillectomy, though, did it go into the chest if she does get sick?
No, it never did.
It never did? Okay.
No.
Okay, what else have we been told? Or what else have we done? Okay, some nutritional things, and I tend to go nutritional initially with any kind of upper respiratory tract infections, ear infections. Vitamin C. I will dose, depending on the age and the weight of the child, I will dose anywhere from like 250 milligrams to 2 to 3 grams spread throughout the day. Depends on the age of the child. Too much vitamin C, vitamin C is an antioxidant. Too much vitamin C, if you have too much vitamin C, one of the first things that you'll experience is gas. So with the kids, what you'll find that he or she gets bloated or they're passing gas. So it's going to be a little stinky. And if it's still too much, what you'll see is that they'll have loose bowel movements. For the mom, and who's got the baby, like if she's nursing, then I would give everything to mom to take rather than the infant. Zinc is another antioxidant. It's involved in a lot of different pathways. It is very important in terms of nutrition, and also specifically important for kids with Down syndrome and also with cognition too. So zinc, I would dose from 10 milligrams to about 25 to 50 milligrams, again, depending on the age and depending on the weight of the child. Vitamin A. Vitamin A is another antioxidant. Kids with Down syndrome, because there is can be an issue with thyroid function, may not be able to convert beta carotene to vitamin A, to the active form. So vitamin A would be better for them to be taking. And it can be anywhere from 1,000 to 10,000 IUs. Yep.
Would you recommend a regular vitamin C supplement for older children?
Not in the spring or the summertime. I rather they get it through food. But if they do have a chronic immune system issue, then yes.
I didn't fully understand what you said about the thyroid issue and the beta carotene.
In order for thyroid to be optimal to work, you need to have vitamin A. And the thyroid gland is also involved with the conversion of beta carotene to vitamin A. So when it's underactive, you don't get the vitamin A. And vitamin A itself is an antiviral. So in the very first part of a cold, you want to make sure that they have vitamin A, like supplemented. So this is more so if the child has issues with thyroid, let's say that, okay? If there's no, but a lot of the kids with Down syndrome, probably about say 50% of them will at some point will have issues with thyroid. So that's one of the things when I get into what we want to do for maintaining health, that's one of the things that we want to keep checking.
Traditional medicine said that will go away.
Yes.
Does it go away?
The thyroid? I would not play with thyroid in a young child. If a young child has a problem with thyroid, I would put him on medication. And the reason why I put him on medication is because the thyroid is linked to cognition. Yes. So I wouldn't play with it. If later on you want to play around with the thyroid, but keep checking the thyroid hormone levels and the thyroid hormones, that's fine, but not in the very beginning, not in the formative years of a child's life. Okay? Right. Yep.
Numbers on the blood test indicate the problem with thyroid TSH.
What number?
What numbers?
So there is the Canadian or the Ontario endocrinologist. What they look at is anything above 5 for TSH to be considered a problem for the thyroid. But if you look at other endocrinologists, like in the States, for instance, they look at anything above 2.5 to be considered a problem with thyroid. So in Ontario, we're a little behind.
What's the 2.5 milligram?
No, I don't know the units. But are you from Ontario? Mm-hmm. Okay. It's all of the labs will have. It's either micrograms per milliliter or something like that. I don't know. Okay. So the vitamin A. Variety in food. Most of us, especially when the kids are really young, they have a very basic diet. And in order for kids to not be sick, to prevent, we need to make sure that there is variety in the diet. So variety in the diet means that fruits, vegetables, protein, whole unprocessed foods. Decrease some of the breads. A lot of the kids with Down syndrome, and general population, I should say, have a bit of a carb addiction. So most of us, our comfort food is what? Most of us, our comfort food would be bread, right? Bread, pasta, pastries, that's comfort food. That's very carbohydrate based. That's not going to help with your immune system. So going more fruit, vegetable, fruits, protein, legumes, we want that kind of diet. And that's going to get you the nutrients into them and also keep them healthy. So this is also stuff that you can incorporate for the whole family. It's not just for the child with Down syndrome. And I've grouped the frequent ear infections and the upper respiratory tract infections together because With an ear infection, there's usually an upper respiratory tract infection. And usually the upper respiratory tract infection will come before the ear infection. So some botanicals that are, and I tend to use food quite a bit rather than mostly supplementation. So when somebody's coming down with a cold, in our family, when somebody's coming down with a cold, what we tend to do is make a big bowl of salad. And we will put in a few cloves of garlic. We've got a big family, there's 5 of us. So it's huge. And there's garlic in it, garlic and onions in it. And that typically keeps all of us healthy. The person who is sick, like not the last time my daughter was sick, just 2 weeks ago, that was pretty bad. But everybody else, actually, we kept well. Not really.
Does it matter if it's cooked or does it have to be raw?
Ideally, I don't know who said that. It does have to be raw. Ideally. The antibacterial activities are better in the raw form. If you don't, some of us may not be able to handle it or you don't like it, then a little saute would be fine, but ideally raw. Ginger is also good too, if you don't like garlic. Because for some people, garlic repeats or it causes stomach pain. Ginger is a nice gentle herb. We call it the elderly herb for immune function. So if you can't handle garlic, which is really, really strong and powerful, add in ginger. And onions are also good too. There are other botanicals, there are other herbs that we can do. There's echinacea that we've all heard of. Yeah. Yep, okay. Echinacea would be in the very beginning of a cold, not throughout the whole season. And then there's others, there's astragalus, there's Parikh-Shah, there's a whole ton of other immune herbs that we can also incorporate too. This typically is sufficient for my kids and for my population, in terms of my practice population. If I get people on something like this, as not prevented it as a treatment plan, they usually can fight off a cold pretty quickly. Okay, so if a child is chronically ill, then you want to maybe consider doing the vitamin C, for instance, on a daily basis. You can also consider low dose zinc on a daily basis too. You can also consider, I don't know if I would consider the vitamin A, maybe a 500 IUs, maybe 1,000 IUs depending on the age, but I wouldn't go up to 10,000 or 20,000 IUs on a daily basis. The garlic, the onions, the ginger can be used on a daily basis. Echinacea cannot. Astragalus and Cononopsis can also be used on a daily basis too, for that kid who chronically gets ill. Questions? Yep.
Sorry, is vitamin A, is eating carrots good enough?
That's beta-carotene. Yeah. So all of your dark colored vegetables, the carrots, the beets, the pumpkins, it's all beta-carotene. Yeah, vitamin A is animal derived.
I'm not sure people understand that beta-carotene gets converted by the body to
It does.
vitamin A, but there might be a problem.
Yes, exactly. So there can be a problem, especially with those with the decreased thyroid, and that's why we are wanting to add vitamin A, because it's the active form. Digestive system. So questions about immune? Yep.
I thought you said that generally the immune system is matured by age of 7. Is that true also with our children with Down syndrome?
As they get bigger, definitely, their immune system will mature. Let me give you my child, for instance. He's the third one, so he would get sick more often than my older 2 did. But you know, he's in grade 2. He's 8 years old, and he hasn't really gotten sick this year. Yeah, he's maybe a little sniffle here and there, but he hasn't missed a ton of school. Like he used to miss school when he was in preschool. So about 3 to 4 years of age, he would miss school. But since he started grade 1, grade 2, he hasn't really missed any school. So I guess the long answer, yes. Okay, good. Yeah.
What are the important components of a good probiotic? Like what are the names of them? You know how there's the...
What are the...
You always see 100 billion cells, then you read all the individual whatever the saccharides and granules. What are the most important ones to have a good probiotic?
I tend to, there's two big ones. There's lactobacillus, acidophilus. So lactobacillus and then acidophilus. Those are the two big ones. But then there are other ones too. There's Saccharomyces, there is Streptococcus. It's Streptococcus rhamnosus. There's two companies that have 10 different bacteria. I tend to use those more so, like that company. So one of the product is called Probiocept, and the other one is called Multistrain 10. And these are, they're naturopathic products. So you won't really find them in health food stores, typically. They have to be refrigerated. Most probiotics should be refrigerated.
And where would you find them?
Which ones?
The
ones, the Naturopathic College at Leslie and Shepherd. They.
Not from Ontario.
Okay. Most naturopathic doctors will carry